Hello. We will be getting started in just a couple minutes. I'm just making sure that everything is prepared. Hello, Cody. Good to see you. Hello, everyone. Let me get my earbuds on. Hopefully they don't unalive on me. Hello, hello, hello. What's that? Maybe, yeah. Yeah, that could be helpful for sure. Was that? Yeah. All right. Thank you guys, everyone, for coming in. So, we are going to be discussing the future of public health with RFK Jr. and functional medicine and all of the things. So, definitely tune in. We'll be here probably for like an hour and a half. Feel free to ask any questions that you may have. So, we'll go ahead and get started. So, the current public health agenda, if you're not aware, is Make America Healthy Again. And the focus is around chronic disease prevention, root cause medicine, vaccine, skepticism, and food and water policy reform. So those are our current policies that are being kind of put forth with the current agenda. Hey, Melanin. And so we wanted to kind of look at these and also look at some of the recent appointment picks. All right, so understanding chronic disease. So nearly 60% of Americans actually live with at least one chronic condition, and treatment usually consists of about 86% of the healthcare spending. So we're spending quite a bit of money on chronic disease, and chronic disease are typically lifestyle modifiable factors. They are things that we can change through having a healthier lifestyle. So this kind of shift from more of a symptom-based treatment into more of a root cause methodology. Hey, Sajas, where we're looking at those underlying factors. So looking at nutrition, looking at environment, and then naturally lifestyle interventions. There has been a call to revisit the vaccine safety mandates and looking at peer-reviewed studies, because there have been claims that the vaccinations were not placebo-controlled, and so wanting to kind of revamp and review the safety debates, I believe individually as well as collectively, and specifically a focus naturally around COVID. They've already launched a lot of food and water reform, so targeting agriculture subsidies, chemical additives, and water fluoridation. And so there's definitely more of a push towards, hey, Lex, a push towards stricter pollutant regulations. Now, all of these things sound great on paper, okay, but in actually doing things like this in public policy, trying to kind of rip the proverbial rug out from under public health really destabilizes public health in general. Hey, touted kisses. And so while these agendas may seem, wow, that sounds great. We want more, we want something to end the chronic disease crisis. We want something for, we want to address more of the root causes. We want to look naturally, we want safe food and water, and we want safe medications. However, a lot of this is mired because MAHA agenda is not in its own little bubble. It's a part of an overarching administration with the Trump administration. And so it's not in this little silo. So while some of these things sound great, it also has to go in alignment with the current administration and what their goals are. Some of the key appointments that have been put forth, Dr. Marty Markey, he's FDA commissioner. They've also done a lot of like consolidation and through Doge trying to close out like NIH or CDC and some of these larger institutions and kind of condense them down. Dr. J, I'm not going to butcher his last name. He's the acting NIH director. He's Stanford trained. Dr. Marty is John Hopkins trained, and has done a lot of work in advocacy work and reforming drug or rug policies, where Dr. J has been really an outspoken critic of the COVID-19 policies, and really speaks a lot to research as it pertains. Dr. Oz, yes, that Dr. Oz is responsible for Medicare and Medicaid as a CMS administrator. And then this new appointment, Dr. Casey Means, who's photographed right there, she's been appointed as a Surgeon General. Now, kind of aghast me with all of this was that Dr. Means has not, she did not complete her residency. She completed her Stanford, she actually has a bachelor's of arts degree, and then she went on to get her, doctorate in, from Stanford University, but she never completed her residency. She quit her residency, then took an 11-week functional medicine course, which, if you know anything about functional medicine, an 11-week course is pretty foundational. She opened a practice for about 6 months after that, and then quit that practice and then opened a health tech company with her brother. She co-wrote a book with her brother. And her brother also provides insight to the MAHA team. So this was very alarming. I mean, the Dr. Oz, the RFK Jr. was alarming for me anyway. The Dr. Oz was alarming, but when we got into Casey Means, that really sent a lot of alarm bells off. Some of the influential voices that you may not be aware of that are in the backdrop, this gentleman right here is Dr. Mark Hyman. He's very well known in the functional medicine space, and he's a co-founder of Function Health, and he's a key advisor to RFK on the national health strategy. So he's been friends with him for a long time. Callie Means as well is Casey Means's brother. He was he's an attorney, and he co-wrote that book with Casey, and he's a food lobbyist. And then Vani Hari, hopefully I'm pronouncing her name properly. She's the food babe. She's a social media influencer as well, and she talks a lot about food and food safety and those sorts of things. So those are the people that are advising the MAHA guidance staff behind it. So now let's look at what's actually changing in public health. So far, there's been over 5,200 health agency layoffs. So people that were established in their roles and their positions were laid off. The CDC suspended the flu shot, as well as any campaigns for that. The research priorities shifted drastically, with NIH really prioritizing research of chronic illness, autism, and environmental exposures. And then food policy has really, they're pushing for it to remove fluoride, seed oils, and then food dyes, additives, and colors. Now, these were advisements to corporations. These were not actually put into any sort of law. They were more so advisements. And then vaccine policy reform, really for more informed consent language. So informed consent, meaning the recommended treatment, any and all risk factors, which is incredibly difficult to provide, because in adverse childhood experiences with vaccines, we use the VAERS system, which is an online reporting system, which is, it can give false reports and that sort of thing. So there really is no standardized system per se to be able to, structure proper informed consent around vaccine and vaccine policy. Now looking at the research that was terminated. So under Trump's administration and now under RFK, 694 grants were cut almost instantly. 1.88 I apologize, my mic. So $1.81 billion of funding was also cut. And then $506 million of spending reductions were done with NIH. And then $224 million of minority health cuts. So there's currently a kind of attack on quote unquote DEI. And so all of the studies and research that has been shaped around advancing understanding of DEI or anybody that falls under the DEI category, all of that has been pretty much it's done. In terms of research, university research, naturally, our universities participate in research. 100 at Columbia University alone, 157 grants were terminated because of campus protests, political response to the pro-Palestinian demonstrations, and so it affects multiple research departments, not just one in particular. And the faculty is, continuing to reorganize to try to fight back. Harvard University's $2.3 billion in research funding was frozen. Legal action has been filed against the administration. Graduate programs are facing immediate disruption and potential long-term damage to the research pipelines at Harvard. There's also an international impact of funding changes have extended beyond U.S. borders. So Echo Health Alliance is banned from federal funding. Spanish cancer and HIV research has been suspended, and there's lots of restrictive NIH requirements that are causing lots of delays. So these things were kind of done instantly, like kind of peeled the Band-Aid off. And so again, in healthcare, nothing is fast or should be fast because you're dealing with people's lives and you're dealing with all kinds of different processes. So a lot of these things, again, were stripped down pretty quickly, pretty instantaneously. There's also new guidelines and restrictions around the CDC and public health. So there's publication research. So again, going back to that DEI. And so publication research, the CDC's scientists have been ordered to redact any kind of research that contains terms like gender, transgender, LGBTQ, non-binary, etc. There have been also program eliminations as well, divisions of for DV, domestic violence, and antibiotic resistance. Those have also been restricted. We know with the CDC also there's been mass staff reductions, upwards 1,300 CDC employees have been laid off. And then there's been a huge data purge as well at the CDC with over, I believe it says 6,000, I have my glasses on, web pages and 3,000 databases, again, on gender identity, on environmental policy, and anything in the diversity, equity, and inclusion umbrella. So legal challenges against. So again, we went through 694 grants have been affected and have been canceled as a result. Hold on, let me make sure that I've got the right. Oh, thank you, babe. Appreciate you. Yeah, helpful to put my glasses on. Hey. Let me go. Let me make sure I'm on the right. 1, 2, 3. Okay, cool. Yeah, so legal challenges, 694 affected grants. The research projects were terminated between February and April. That $1.81 billion funding loss, which was critical to medical and public health research. And then 5 key research areas have been restricted: HIV, domestic violence prevention, many health disparities, specifically around DEI, people that fall underneath that umbrella. So women's health falls underneath that umbrella, minority health falls underneath that umbrella, and also Alzheimer's studies have been impacted. So they have kind of grouped together and filed a lawsuit, but with all checks and balances, it is going to take some time just because these funding were cut so abruptly. There's also a lot of ethical questions. So this is my concern. So it's, yes, we know we have a chronic disease issue in this country. We know we have a lifestyle related problem. We know that these things exist. These are not, far and away, new information. But where my concern is the ethical question. So while the Trump administration is slashing Medicare, Medicaid spending, so that people no longer have access. And we'll talk about the ACA, the Affordable Care Act, and we'll talk about kind of what that did. While the more affordable options are being canceled, the health insurance is now, or health system is now being more privatized. And so more of a for-profit. So that Dr. Mark Hyman I was talking about with Function Health, so he started a company, it's like a lab testing company. That company has absolutely skyrocketed since RFK has been in office. So to the tune of $191 million, he just went to a $2.5 billion valuation in 1 year. So that was about a 1,200% growth during the MAHA initiative, because he is one of the people that are, feeding information. So his policy influences now have profited significantly, and he's now moving into the preventative health supplement market. And so I'm not opposed to people making a living, but I am opposed to people that are using the government to do it while also leaving out people who otherwise wouldn't be able to have care. The Food Babe also secured a brand deal with Target to launch, I guess, a campaign, a food dye campaign, and there's a lot of marketing that's involved with that. And then Dr. Casey Means, who also has financial interests with Hyman, has a health tech company. Remember, once she left her practice after 6 months, she opened up a health tech company after she co-wrote a book with her brother, who's an attorney. And so as a response to that, of course, with the exposure, now, her health tech company where she's selling glucose monitors, that's going to go through the roof. So the ethical concerns here are these conflict of interest. A lot of these people are entrepreneurs. And while I can appreciate entrepreneurs being a part of the governmental process, also too, these entrepreneurs very much are privileged entrepreneurs. And what do I mean by that? Is they haven't been impacted by, let's say, food deserts, or they haven't been impacted by systemic racism, or they haven't been impacted by, for instance, the all of the research cuts. And so as a response to that, they're not necessarily seeing the forest for the trees, but instead on the back end able to profit. And that's why I call it kind of a big grift, because really they stand to really benefit. So like we talked about here, so the winners of this new kind of health landscape, obviously Dr. Mark Hyman, just within a year, his worth shot up to $2.5 billion. I'd say that's pretty impressive. If you ask me. And so the insider trading that's going on. And then the Food Babe, now she's, doing her market expansions. I also saw her on Fox News the other day, backing Casey Means and trying to, gaslight us into her education. And then True Bar, which is another company as well. That's expanded their growth sales, specifically into Target, as well as Costco. And so they benefit from that clean label movement. So again, there's the conflict of interest. So the MAHA, movement, if it will, while it may seem on the surface, oh yeah, we want to reduce chronic disease. Thank you so much for the roses. We want to reduce chronic disease. We want to get more education out there. We want safe and healthy things. But unfortunately, what's happening is that there's a grift on the other side. So MAHA figures are actually promoting more of their affiliate companies in the process. So they get to make money off of the back end, while at the same time cutting funding for our pretty much our poorest and people that are most at need. And this mindset of, oh, what we'll do is, with government assistance and EBT and food stamps and all that, we'll just make it where they can't buy junk food. Well, again, this very privileged idea, because I think by and large, people wouldn't necessarily buy junk food if they could afford healthy food, if the healthy food was safe, if the healthy food was actually indeed healthy. But with herbicides, pesticides, and GMOs and food deserts, that makes it really, really difficult. There's also a lack of transparency. And so we don't see the, adequate ethical guidelines. There's not just disclosures. Even when we go and, let's say, have I go to a talk or something, I go do continuing education, the presenter even will disclose who's paying for their presentation. So we are not getting any of that. So there's really no conflict waivers. So these people, including RFK, who is, most known for taking the pharmaceutical companies to court and winning and that sort of thing, they stand to win a lot of money and enrich themselves. I was really, really pleased to see the one of the founders of Ben and Jerry's actually protesting. He kind of got body slammed, arrested in the Senate hearing. I think it was a couple days ago, but definitely look that up. I was really, really happy to see that. So unfortunately, public health, has suffered quite a bit, especially through COVID. So there's already a declining confidence in these agencies, meaning that people don't really trust, CDC anymore, or NIH, or any of these institutions, unfortunately, because of the mismanagement of COVID and just because of the fast tracks and the lies and that sort of thing. And so media scrutiny has definitely intensified. But my concern is the professionalism and concern of making sure that the public actually gets proper informed consent so they're able to make, these decisions. Again, this public health erosion has been going on for a long time. Major health organizations have faced lots of scrutiny. People don't trust, your standard healthcare anymore, your standard healthcare practices, mostly because of the misinformation, the gaslighting, and all the things that they're receiving. Also, too, the media coverage is very skewed, so we're not getting unbiased information. We're getting biased information based off of whatever network is being run. Anytime, even if you say that you want, healthy information about vaccines per se, you're labeled an anti-vax, when in fact you may not be anti-vax. You just want to make sure that you and your family are safe when they're taking this particular medication. So there's also this public perception about alternative medicine. People don't really understand alternative medicine. And so I'm going to use these words interchangeably, but alternative medicine is different from complementary medicine, which is different from functional medicine, which is different from integrative medicine, which is different from holistic medicine. So these are all distinct practices with all distinct trainings, but unfortunately, they're just all kind of mislabeled and jarbled up into the same thing. And so there is a professional relationship that is being strained, not to mention the fact with the overturning of Roe v. Wade, the privacy between a patient and their doctor is also compromised. So, we have it on many, many levels systemically. We have it on the individual level. We have it on the state level, as many states, especially with near and total bans, are unfortunately, their maternal mortality rates are going up, their infant mortality rates are going up, and many of the states with the total bans, like Texas and Georgia, will no longer be reporting. The last public health reporting we had on maternal mortality rates in Texas alone scored the maternal mortality up to about 50, I think it was like over 56%. Standard average has been about 11%. So you can see that number just skyrocketed as a response to the legislative changes. However, there has really been no concessions, even with the data. In fact, there's been a doubling down. So now we'll get no future public health reporting. And there's also been cases of, women trying to leave the state and also getting prosecuted as a response to that. So they're trying to make some inroads on creating laws where women are not able to leave the state, which again, this is very, very dangerous for women. Whatever you believe about, AB or not having AB, a D&C is actually a healthcare procedure. And so women not having access to this healthcare procedure, doctors, hands being tied, and also, a trigger finger government. These are not good combinations for anybody's public health. Just for a little bit of contrast here. So full disclosure, I'm not a huge Obama and healthcare fan. I've finished my clinicals when the ACA was coming out. And because the ACA came out, that's why I have my MPH, because I needed to study the healthcare system. But here's what he did actually with his public health policy in the ACA. So we did expand healthcare access, and when we're talking about access, we're talking about health insurance. So remember, lifestyle changes is not a light switch, right? So there are people that are going to not want to change their diet, not want to change their water, not having access to those foods, having mental, emotional, psychosocial, spiritual, traumatic experiences. We can't go take them and put them in a camp. We can't pray their, sins away or whatever. These people need integrative care. And what's integrative care? Integrative care is when we integrate conventional medicine with our natural practices. So, if you need a medication, for instance, or a procedure or a surgical intervention, having access through Medicare or Medicaid if you cannot afford traditional insurance. As you know, during the ACA, people's insurances went through the roof before the exchanges actually went in. It was really it was an ish show for sure. However, Obama's ACA was definitely trying to move us towards prevention focused. It was trying to modernize the infrastructure. We actually went from paper charts to digital charts during that time. It was a nightmare, scanning and scanning and scanning. I still, anytime I look at a copier, I break out into a cold sweat. So there was a lot of upgrades that happened as a doctor. When you get medical records from another provider, and it's literally, my handwriting is chicken scratch at this point. So, getting another doctor's chicken scratch, and not being able to know what was going on in those notes, having a more modernized system, and now moving to digital charts where we can fax them over or email them over was a significant upgrade to our healthcare system. Also, too, Obama looked at addressing mental health as well, and expansions on mental health. And then there was a global movement staying connected to the World Health Organization and any new research and things like that had come out through there. So it wasn't all bad. I know pricing structures went up. The exchanges were a crazy, insane mess. And pricing rates went down, and there was definitely a lot of challenges. It wasn't all beautiful. It was very much forced at the end, in my opinion. And then let's look at Michelle Obama as well, because she was equally a part of the public health strategy at the time. You may be aware of her work in the schools. She did do the Let's Move initiative, which was trying to really combat childhood obesity and looking at nutrition for children specifically, looking at nutritional standards, and then increasing physical activities in programs. She did try to champion nutrition fact label changes because the nutrition facts on most products are skewed because of lobbyists. And so she did try to tackle also food deserts through like community gardens and things like that. She was really trying to get into the communities and get more people working together. There was also a White House garden that she used to create for education, or promoting sustainable food systems and offering hands-on nutrition education. And she had planned to do that in the different communities as well. So it was very much a hands-on approach. Naturally, she got vilified for her attempts, and there was a lot of resistance and a lot of negativity. So I really wanted to bring out their contributions so that you could see those. So there was a shared value there of equity, so getting to the underserved. It's not just about the elites and the top tier people who can afford, healthcare. I know in my practice, I never really wanted to appeal to that top demographic, even though I have patients in that demographic, simply because I wanted patients to be able to access, even though I chose to not take insurance. There was also a lot more conversation around preventative care. I think in that original bill, that was the first time before it got all cut up. He talked about our, healthcare system being a sick care system. And that was really the first time that a politician per se really spoke about our healthcare system being a sick care system. There was also a lot more focus around youth and family values, naturally with the child programs, the school nutrition programs, the physical activity. It was very much family centered. And then it was more system change. So combining top-down policy reform and grassroots mobilization. However, I think there was a lot more concessions made with pharmaceutical industry and pharmaceutical companies, which of course, definitely didn't do us any favors in the long run. Okay, now let's look at Donald Trump's policies. So he tried to repeal the ACA, I believe twice. He tried to repeal it, and it didn't go through. He did attempt to expand some short-term insurance plans and promoted Medicaid at work requirements. He also executed drug price transparency. During the pandemic response, there was the Operation Warp Speed, and he relied more heavily on state-level pandemic management. So it was very much a hands-off federal approach, and it was more state-ran, which was really chaotic because that's not how it was done before, especially in a public health crisis. There was also lots of infighting. We were not getting clear information, and there was a lot of confusion. Literally, people that worked in healthcare can tell you we got different messages literally every day. Every day it was like, oh, it lives on surfaces. Oh, no, it doesn't. Oh, we have to do this protocol. Oh, no, just kidding. We're not doing that. So like every single day, it was a lot of chaos. He did propose those CDC and NIH budget cuts, and then also was already looking at limiting research on climate, LGBT health, and then gun violence, pew-pew violence. And then the one thing that he did do that was really helpful for everybody was expanding the telehealth initiatives, but he did roll back about 100 plus environmental health regulations. Again, it's kind of when you let the wolf in the hen house sort of thing. So he's going to back big business. He's going to back corporate. He's not necessarily going to consider how that top line is going to affect the bottom line people. So lots more emphasis on deregulation, state autonomy. So it's kind of like every state for themselves. So if a state doesn't necessarily have the budget for that or the funding for that, in essence, they're going to be unprotected in any kind of public health risk factors. So looking at these different components, hold on one second, just looking at the comparisons here, we see kind of Obama as, trying to do something with healthcare, even though it was very imperfect, trying to do something with healthcare, then Trump kind of going in and trying to reduce down pretty much everything that had been done, and then Biden trying to kind of pick up the pieces and try to pull things together. So specifically trying to strengthen the ACA expansion, trying to ensure that people had expansion on Medicaid, even on the state level, and making sure that there was appropriate funding for various different public health initiatives, but also more preparedness. Also too, with pandemics, future and present, there was plans put in place. Naturally, I think we put plans in place and Trump laughs because he has his own plan or concepts of a plan from what I've heard. Obama and Biden both really tried to focus and expand on mental health, where Trump's focus on mental health really was more just towards the opioid crisis, and so now it's shifted over to the fentanyl. So he's mainly focused on addiction rather than mental health as a whole. So these academic influencers, so there are a lot of influencers that are there to support. So it's not just, one individual per se. And so Obama's team had a lot of public health academics. Biden's also had a lot of science related people. And there was a lot of ideological imbalance. There's a lot of ideological balance. So it's bipartisan on both sides, really trying to incorporate both progressive as well as moderate voices, where Trump really relied mainly on those conservative voices and then really focused on more industry voices. And so elevating more of the pharmaceutical and the insurance executives and their input on privatizing. And then also Obama and Biden both wanted to strengthen their relationship with the World Health Organization, where Trump wants to go more of a America first. So he wants to sever ties with the World Health Organization and no longer be a part of their affiliation. Again, who also is advising RFK Jr. are his group of health advisors, as we talked about before. We have Dr. Mark Hyman. He did do a lot of work with Cleveland Clinic, but he is more so in the health influencer space. I think he still does take some patients. Del Bigtree is an anti-vax activist, and he's been involved in fundraising and communication for MAHA initiatives. So they definitely have got in with a lot of social media clout. Callie Means, which is Dr. Casey Means, which is the Surgeon General nominee. This is her brother. He is an attorney, and he advocates more for health policy. I did listen to a podcast that he was on, and he seems kind of green when it comes to holistic health and natural medicine and that sort of thing. I think that their main concern is around food and getting healthy food, which I think is great, but that's definitely not going to help us for public health as a whole, because having healthy food is only one aspect of public health. You still have a subsect of the population who still needs to be on pharmaceuticals, still needs procedures. We still need to have, acute care, pandemic style policies, and also plans in place, not concepts of plans, but actual plans in place to ensure that people are safe. And then the food babe, which she's already kind of making her rounds on Fox News. You'll see her. She's talking about the food and the food supply and those sorts of things. So these are it. There's no minority. We do have a couple women that are on there, but apparently they're not paying attention to the fact that now all of the women's health research has been canceled and there's no funding attached to that anymore. So again, it's very short-sighted. It's like, oh, yay, let's move towards this chronic disease crisis. But then those people that already have chronic diseases and can't afford it, oops, we're kicking you off Medicare. We're kicking you off Medicaid. Good luck. Hopefully you've got $500 to book a consult with Hyman's team, or hopefully, you've got some hey, little sassy, you've got some money, around where, maybe Food Babe's new food program or something that you can invest in. So you see, like, what it's doing is it's turning, what needs to have a public system attached to it into more of a privatized elite system. And so the Political Action Committee that supports MAHA's initiative and goals is a planned agency under the Department of Health and Human Services, and they're aimed at improving the efficiency and coordination of public health efforts. So this is why the consolidation in their mind. So this is why canceling the CDC, canceling NIH, canceling these larger organizations. Now, again, there has been much corruption in the past. Hey, yes, there has definitely been corruption in the past when it comes to the CDC. There's still corruption. There's corruption with NIH. There's corruption with these health institutions. We know that. But again, when you are doing a a controlled public policy initiative, it has to be done in stages. You can't just pull the rug out from under research that's been backed and funded, or people that otherwise wouldn't have access to that. The ACA, while it was very imperfect, it definitely allowed more people to have access to the healthcare that they needed. And so even though the healthcare wasn't perfect, and maybe it was more of a sick care focus, a lot of these people, because they didn't have the money to go to the doctor, their health unfortunately declined. And then as a response to that, by the time they were able to see a doctor, they did need more intervention care. So we have to kind of get our head out of the clouds here. Not everyone is going to eat healthy. I know that's horrible. I would love to say that every human being on the planet is going to change their diet, drink water, not smoke, not drink, drink more water, move their bodies more, all of the things. But unfortunately, in reality, we're talking about an entire population of people. And right now, the majority of those people are carrying at least are carrying at least one chronic disease. So if that's the problem, again, putting those people at risk and not giving them any sort of alternative really puts those people into a free fall. And then on the back end, enriching yourself with your health influencing. So, and I am not opposed to anyone's hustle, right? Like, hustle on, hustlers. However, when it comes to making sure that everyone gets equitable care, that's a concern. We're already very much behind when it comes to women's health. Roe v. Wade was not just, it wasn't about unaliving babies. It was about the doctor and the patient being able to have that private relationship and to be able to make those healthcare decisions. That primarily was the purpose of Roe v. Wade with the 14th Amendment. And so not having that, now that's being dismantled and removed, oh, awesome, I'm so glad, now that has been removed and dismantled, now that healthcare relationship is very much on shaky ground, meaning that doctor-patient relationship. And if you are a doctor underneath the AMA and your license is held with them, you're pretty much having to give marching orders to whatever you're being told, which is why a lot of the doctors were complicit during COVID, inoculating. And if you were a doctor who spoke out during COVID, naturally you were reprimanded. So there was a lot of internal tension. So this didn't just happen out of nowhere. I think that it's long in coming for there to be healthcare reform. However, when you're dealing in public health policy, if you have experience in public health policy, you know that these things cannot rapidly just change. Canceling, billions of dollars worth of research and funding is incredibly dangerous, especially when many of these research, that they're doing is on HIV, domestic violence research, women's health issues. These are significant problems within our public health sector. And now diverting it to focusing on studying autistic children, while of course everybody needs funding and support, we probably needed to implement that after the current initiatives and or received endowments through other people. Kind of going again to what MAHA's initiatives are, they are to focus mainly on preventative care, but unfortunately, the prevention is going to have a price tag attached to it. We already know that our food supply is going to be impacted with tariffs and all of the various different negotiations that are happening. So we definitely need to focus on prevention of disease and focus on nutrition. I always ask the question of, how did the food get poisoned to begin with? Oh, you're so welcome, Tanya. How did the food get poisoned to begin with? Because we focus a lot on, the food supply, but not necessarily focus on the origins of the food supply. So I'm not necessarily excited about, celebrating people that created the problem. that are now attempting to fix it. We are still in post-colonization. So before we were taken in the transatlantic slave trade, or before we were genocided on our own land, we knew how to grow. We were farmers. We did cultivate the lands, etc. And then through colonization and greed and corporations and all the things, the food supply now has herbicides, pesticides, GMOs, and the various different chemicals in them. So now initiatives to remove them, while, sound good on paper, who created these issues to begin with? So really, it's not about, excuse me, celebrating people for doing the very basics. It's about reclaiming. The government is not here to save or fix anybody. And so rest assured, and in fact, with these initiatives, as I've looked at them, it's really just there to profit. Also, too, we're conflating a lot of practices. Integrative medicine is a practice all in of itself. Integrative medicine is when you're trained in conventional and you're trained in natural medicine, and you combine the two. You know how to integrate them. Alternative medicine it has the least amount of science to it. It's an alternative. So instead of taking, let's say, a blood pressure medication, you're going to look up an herb and let's say take hawthorn berry. It has the least scientific efficacy on it. Holistic medicine comes from an Afro-Indigenous line, so you have to have some sort of cultural adaptation or cultural connection to holistic medicine. And holistic medicine is more of a lifestyle-based medicine. And so functional medicine is more of a systems-based approach. So you're using laboratory diagnostics to be able to assess the systems, organ systems that are affected, and then be able to support them. So these are all distinctive practices, but with this current administration, they're going to be using these words all over because they're buzzwords and they're marketed words. But these words actually have true meaning. And this is why when I saw Casey Means, where she's only done, a 11-week functional medicine course and practice in functional medicine for 6 months, but now is promoting herself as a functional medicine expert, I was absolutely aghast. It takes a minimum of 4 years before you're even somewhat proficient in functional medicine because it's so much information. Also, think too, she was conventionally trained, meaning a conventional doctor. Conventional doctors are not trained in integrative medicine. They're not trained in alternative medicine. They're not trained in functional medicine, and they're not trained in holistic medicine. But what's happening right now is that they know that the general public no longer trusts conventional medicine. They're losing money. And so now they're hanging their shingle, whether they receive certification or they receive education, they're now hanging their shingle as alternative, holistic, integrative, etc. doctors with no training. So again, that's ethical concerns. It raises a lot of ethical considerations. If you don't have qualifications and proper training, but now they're putting out to the world that they are holistic or they're integrative or they're functional or whatever, now people are going to assume. So again, we see this, I've seen this for years, where functional doctors are not necessarily trained efficiently. And so what do? They overtest their patients, which charge the patients thousands of dollars. They give their patients way too many supplements. So now the patients are, overtaking supplements, and they lack therapeutic order and they lack understanding of how the body actually works. The other thing too is there's the terminology misuse, which creates so much confusion in the space. So people assume that functional medicine is the same as integrative medicine, which is the same as holistic medicine, which is the same as alternative medicine, which they're all distinct practices and they all require distinctive education. When I say I have 7 degrees in my field and hundreds of certifications, I mean that. The reason I have that is to have a depth of understanding of all areas of holistic, integrative, functional, mind-body medicine, etc. So with the public confusion, patients are now going to struggle even more in terms of determining who's a good provider for them and who's not. Not to mention there's going to be huge regulatory gaps that exist, and there already have been regulatory gaps. So you have people with no training, no education, not even conventional, now coming on the internet, and now they're experts and they're going to prey on people's desperation, especially with healthcare. So you see that it's very gimmicky when people come on and they're selling a supplement or they're selling an herb and they don't take any data, or there's no therapeutic process to the patient, or they're working completely out of the scope of practice, or have no therapeutic order at all. The general public is not going to be able to determine and, hey, Chrissy, distinguish between what is a qualified, natural healthcare practitioner and one that is not qualified. So it's going to create a lot of more confusion that needs to be. So there's misrepresentation that's happening, misrepresentation of the field. Naturally, there's a lot of diminished expertise. So people that have been in the field for a while, who cares about us? We're just, the help, I guess, and so now this kind of new wave, 3 steps to mental, emotional enlightenment, or 5 steps to having a holistic lifestyle are now going to prevail. So the discernment is going to be even more for the general public to actually understand who they're seeing, why they're seeing, etc. My real concern is leadership qualifications. So holding these positions like the Surgeon General, like the CMS administrator, these are not entry-level roles. These are not, this is not on-the-job training roles. However, the people that are being put in these positions literally have no training or experience in public health policy, in leadership of staffs that large. All of these things are deeply nuanced. And if something, if ish goes down or ish hits the fan, we're going to be in some real dire straits when it comes to public health. I know I didn't watch it quite yet, but I know RFK Jr. just did a new Senate hearing, and I see some of the headlines are, don't ask me for medical advice. Well, we understand that naturally we can't have, the head of Health and Human Services provide healthcare advice. However, there is public health standard, that's awesome. Thank you so much. So the thing is that there are public health standards and there are structures that we're taught and we're trained in school. All of those are out the window when we're dealing with people that don't have education and don't have experience and don't have training. And so it's pretty much just everybody's winging it. And we don't want people winging it when it comes to your healthcare. Really, what separates the good doctors from the great doctors is being able to operate under pressure. So when we saw COVID, we got to see which doctors were good and which doctors were great, right? Because the amount of patients that we had to address, the amount of misinformation that we had to kind of sift and sort through. One of the things that I was grateful for, because I'm a functional doctor, I take all of my own data. So I was able to go through my charting because we were in digital charts at the time. I was able to run reports. I was able to call all of my patients who had cardiometabolic and immune system compromising, and be able to give them supplement protocols, and we didn't lose any patients. So it's being able to have the appropriate education, the appropriate training, also too, even just in cleaning my practice. I shut my practice down. We went through like triple wash. We did a lot when it came to, we did the standards that I was trained in my public health degree. However, during COVID, all of those standards went out the window, at least on the federal level. And it was pretty much just every man, woman, child for themselves. So the debate, is this really health liberation, right? Because it sounds good on paper. It sounds like, oh, wow, having holistic medicine on the federal level, having natural medicine on the federal level, addressing chronic disease, addressing root cause. But the problem here is that patients, your average patients simply cannot afford a functional intake. They can't afford a $200 consultation. They have to save up for that. They can't afford, and I'm on the low end for crying out loud. They can't afford a $500 consultation. They can't afford $300 worth of supplements. They can't even afford to go to the grocery store and get healthy food, a whole basket of healthy food without it costing $200, $300, and $400. And so again, as we privatize healthcare, right? So letting go of public sector and then going into this elitism and this elite-backed deregulation, because they are deregulating. Trump is going to be deregulating environmental standards. So what's going to happen? There's going to be more toxicity in our environment. When there's more toxicity, the body's going to be impacted by that, right? And it will not matter how many glucose monitors that you are wearing, okay? It's not going to matter how many Fitbits you have or Garmin watches that you have on. It's not going to matter any of that stuff if you can't access healthy water, if you can't access healthy food, if you can't access or afford proper housing. These are issues within the public health space. And then we look at communicable diseases. We look at HIV. All that research has been canceled. We look at even Alzheimer's research. We look at, aging and what we're doing to our aging population, restricting and reducing and doing budget cuts on Medicare and Medicaid. Not everyone has a family that can take care of them in their elder years. So that's going to create a lot of issues with our elderly population and not really knowing what to do and how to treat them. So we've got some real concerns, heading down the pipeline. Again, not everything that glitters is gold. And so when we have these buzzwords of, oh, we're doing chronic disease, oh, we're, we want root cause medicine. Oh, we have to lift up the hood and we have to begin to critically think. Not every single person is trained properly in this field. Many people pretend like they are trained. I know, aghast. But that's what people do when they want to make money, they want to catch an extra buck. That's just the way that these things go, unfortunately. And so it's going to be more difficult to be able to discern these things as time goes on. So I've been committed to public health education for a long time. I've been in the field for over 20 years. If you're new to my channel, welcome. I have 7 degrees in my field, spanning from psychology to public health to natural health care sciences to naturopathy to natural medicine. I also have a bachelor's I've 2 bachelors, 2 masters, 2 doctorates, and 1 associate degree. So that kind of spans all of my education. And then kind of working towards a PhD in international psych. So I took a break and kind of cooled out a little bit, but I'll get back around to it. And so, the thing is that, having a depth of understanding in all of these different pieces really allowed me to be able to educate people even throughout the pandemic. And I was able to fly around and do a lot of public health education and provide a lot of free resources to public health education so people were informed. And that's what I'm committed to do, continuing on all throughout this administration, because it's going to be a lot of smoke and mirrors. It's going to be a lot of shiny items. You're going to think one thing, but really, unless you've been in this field and you've been in this field professionally for as long as I have, you're not always going to distinguish what's going on, because it's like a slightest mind, right? It's going to be, this, look over here. Oh, but we're deregulating over here. Oh, look over here. People are losing their health insurance over here. Oh, look over here. It's a lot of these things. Yes. And unfortunately, public health is not one of these things that, is easy to maneuver. I know people assume that it's easy, and a lot of it is because of the special interest groups, the big ag, big tobacco, big pharma. They all have their hands in the cookie jar, and they've had their hands in the cookie jar for a long time. Yeah, so Chrissy had a good question. How do you differentiate between a fake health coach and a real one? So it's really based off of their accreditation and based off of where they trained at. Now, we can even have debates of, even if they've gone to certain schools, the depth of their education and training. And that's why I started my school, was to bring standardization and to bring some ethical standard into the field, because I've seen so much. I would say right off the bat, follow your intuition. If somebody is trying to sell you supplements without talking to you about your diet first, or they're trying to sell you a whole bunch of expensive lab testing without looking at your basic labs first, kind of giving you the too good to be true sales pitches, they can cure things and they use that word, or they can, they've got all this data and all of this understanding, in this, but not actually has the tested time results. Those are all really good red flags. I'll be doing some videos as well. I've already kind of pulled the scripting for it, to differentiate between, like, the difference between alternative medicine and functional medicine, the difference between naturopathy and even naturopathic medicine, so that there's distinctions, or the difference in holistic medicine. So I'll think about it, and I'll do a kind of a deeper video on that as well. And speaking of which, we are on our break right now for Intro to Holistic Medicine. It is a self-guided course. You can register at any time. There's a link in my bio. We're on a break right now, so this is why I'm doing a class like this. Also, I'll be releasing a homeopathic podcast that I just recorded a few weeks ago while I was traveling with Dana Ullman. That'll be released on Decolonize Your Healthcare, which is a podcast that I have. And so I'll be releasing that. So look at that on YouTube and Apple and all the things. And so then May 26th, we start with Intro to Holistic Medicine 2. Intro to Holistic Medicine 1 was all about nutrition and nutrition deficiencies, and understanding how to determine your nutrient deficiencies from a subjective and objective perspective. So we use science in these 12-week classes. So it's an intro course, and then Intro to Holistic Medicine 2. That course is all about detoxification. We'll be using a detoxification questionnaire in that one, and then we'll also be testing urinary pH, bowel transit time, and I may throw in some stomach acid in there too. So we use subjective and objective data. We use a questionnaire along with at-home testing to be able to create your own plans. We also have 4-week classes, which are a little bit shorter. Sometimes people have a better attention span on those. And the 4-week collectives, I'll be announcing probably next week. The 4-week collectives are focused on one area, whether it's nutrition or mental health, or spiritual health, or foundational health, or business, or something like that. So I haven't selected which ones that I'll be doing, but I'm working on the course catalog now for you guys. So any questions about the current administration? We're at the very beginning of things, so they're just kind of still getting all of their people in place. I think Casey Means has to do her Senate hearing, or her, when they, probe them and ask them questions. I'll be listening in. Again, she wrote a book with her brother called Good Energy. I think she kind of appeals to the MAHA movement and the Trump administration. She definitely has the right look for them, and relatively has a pretty small voice. And when I say small voice, is I haven't, she popped up on some bro podcasts probably like a year and a half ago. I've been in this field for 20 years, so I haven't seen her. She hasn't been like this big disruptor that they're saying, oh, she's this big disruptor. Well, when we were being disrupted during COVID, when we were knee deep in it and we were being suppressed with information, and I was flying all over the country and working 18 hours a day, I didn't hear anything about Casey Means. So we didn't hear a word, not a peep. And I haven't heard any of her thoughts on vaccinations and where she is with those. She's been relatively quiet about that. She does have, the traditional views on raw milk and things like that. But, again, coming into this administration, she's going to be eating the poison from a tree. Again, them canceling all DEI research, funding, and any sort of support, again, is very dangerous to mental health, to physical health, to emotional health. Just so you are aware, Commonwealth Fund study 2024, I say this all the time, but they discovered that Black people receive 52% subpar healthcare, worse in the South across all states. So the healthcare system has been failing Black people and people of color for a long time. And especially if you're a Black woman in the system, absolutely, our maternal mortality is 3 to 5 times more likely. MAHA does not have any initiatives, any programs, any desire to do anything to help support us in that. In fact, they are defunding all studies that are related to that. They've defunded any sort of support, and naturally with eliminating out Medicare and Medicaid expansion, it is going to significantly impact quite a few people. So we're kind of in this on our own. The government is not here to save us. The government cannot save us. And so we have to learn how to take responsibility for our own health and well-being. And so that is very dynamic. So that's why I teach from different perspectives. In holistic medicine, we're trained and we teach to help people physically, environmentally, meaning the environment that you live, your relationships, but also the physical environment, the air, the water, the food, toxicity, etc. Your mental health, your emotional health, your psychosocial, spiritual health, and then lastly, your ancestral health, and looking at trauma. Even as I perused Good Energy, while it has a good title, it's really just linking metabolic health. And this is the book by the Means children. So it's really just a book about, all diseases begin from breakdowns in the metabolism. We've known that in functional medicine for a long time. That's nothing that's new. There's been tons of books written on that. And so really the book is positioned to sell her level glucose monitors to be able to, monitor your glucose. You can do that simply without a glucose monitor. It doesn't really take all of that, and you can look at averages and things like that. So again, like everything shiny is not always the greatest thing. And if somebody's struggling to, let's say, eat food or put food on their table, they're not going to spend $400 or $500 on either labs from Dr. Mark Hyman's people or a glucose monitor from Casey. So it's really going to position the haves versus the have-nots. So I want to maintain and continue to be a resource that I've been for years and years and years and years and years for the general public. So educating you and encouraging you really to live a natural life. Right now, in preparation, you need to get focused on your food supply, where you're going to source food. So especially as trucks are slowing, tariffs and things like that, I recommend that you get seeds. If you don't have a growing, like a garden or something that you can grow in, definitely start off with some pots and some herbs and some lettuces and things like that. You can do that relatively easy. Also too, rice and beans, that's a complete protein, so very inexpensive as well. So stock up on that. Lentils, quinoa sometimes can be a little bit more on the expensive side, but definitely start, working with your communities and getting food. Hey, Star Girl, getting food stocked up, because again, with all the tariffs, with the immigration reform, we are going to see significant issues with the food supply, and that's really where your food begins. Also making sure that you have access to healthy drinking water, and you know how to filter your water and filter your water properly. So you may want to get a few different filter sources for that. I'll do a water class here shortly once I get my life together. So so any kind of public health questions that you may have, I'll be online. Naturally, I do teach a morning flow class at 6 a.m., a way to kind of start your day and get yourself ready to go. And then I teach other classes. So I will be teaching on Saturday as well. I haven't thought about the topic quite yet. You're very welcome, Touted Kisses. We will talk about failure at one point. I probably will teach on failure next week. We taught about discipline last week as it relates to your health and your health goals. So these concepts are really important to break down. The lives typically are posted on YouTube afterwards, so they're underneath different playlists. And then also too, if you're part of my holistic lifestyle community or any of my communities, Pure Black, Holistic Lifestyle, or Holistic Health Coaching, you'll also get all of my content sent to you as well. So in the communities, if you are an Intro to Holistic Medicine 1 and you're finishing that up, make sure you go through and do all your discussion topics. Make sure you do your reading, and I'll go through and refine that and make sure everything is good there. So hopefully this gave you guys a little bit of information and a window in. We're going into very uncharted territory. There's not a lot of experience that is ahead of us in the administration. There's a lot of buzz. There's a lot of grifting going on, dare I say. And there's also a lot of people that stand to make a lot of money. We kind of knew this, leading up to the election. Even prior to, in my former life, when I used to do lobbying and I used to do bill writing, it was always the Republican Party that would even entertain our bills. The Democratic Party would not, mostly because a lot of them are backed and funded by pharma. So it was the Republican Party that would advance our bills and would support us in the legislative process. Now, when, again, they decided to overturn Roe v. Wade, that kind of changed the game for me. I never really recovered in politics from that. I'm not really a person that can, again, being a holistic doctor, I look at everything. So I can't go, oh, I'm not going to look at this over here, what you're doing, so that I can move forward over here. And that, in essence, is what RFK is doing. He's kind of turning a blind eye to a lot of it while, promoting some aspects of it. And why would he do that? It's really a grift. It's for financial gain, unfortunately. I'm not saying that all 100% of it is for financial gain, because naturally I believe they think that they're doing a good thing, a good service, but just know at the root of it, they are standing, and they've already made quite a bit of money. Like we said, Hyman's companies went over the billions just in a year, a 1,200% increase. I saw his ads start going up for Function Health literally the day after Trump won. The day after Trump won the election is when I started seeing those ads already, right? And be mindful, because they're going to use very appealing people. They're going to be using, you're so welcome, Patricia. They're going to be using lots of gimmicks and lots of information to kind of get you to, again, come out of your pocket and pay for your healthcare. There's nothing wrong with paying for your healthcare, but you want to pay for your healthcare from people who actually know what they're doing. And so a good red flag, again, is if you're being asked to take too much testing, asked to take too much supplements, if they're saying, oh, we can cure this, we can cure that, and they haven't seen any of your data, and or they lack therapeutic process, meaning that there's a process to which you go through when you're treating. It's not just, here, do all this stuff. That's really overwhelming to the system. So, all right, everyone, I am done with this. Hopefully you guys learned a lot in regards to the current administration. As I get new information, I will present more information, but that's really kind of where we are in the state of public health and public health policy right now. So it's not bad, but we definitely want to be prepared moving forward. The government is not here to save us. It's not here to fix us. It never has been. And unfortunately, Black and brown bodies have been used and exploited in the medical apartheid and are still being exploited even to this day. So it's time specifically for Black and brown people to really divest from the current healthcare system and go back to our holistic practices that we learned pre-colonization, that our mothers and aunties and sisters and brothers and all of our family members have passed down. I can't tell you any person that I don't know who doesn't have some sort of connection to holistic medicine who has an African or Afro-Indigenous background. So it's literally our birthright. and it's literally tied into our DNA. So you can access that quite easily. You just have to be able to quiet and listen in. I knew pretty early on that if I didn't keep this type of practice going, that eventually it would die off. It would get erased. And so here we are. Not only is it being erased, but also now being privatized. So we don't want to do that. So I'll keep you guys informed as I learn new information. I'll definitely watch that Senate hearing and see kind of what was going on. But definitely, if you guys like ice cream, go out and grab some Ben and Jerry's, because the founder was given the good fight and protesting at RFK's hearing when everybody and their grandmother is so excited, so happy, because they can look past the civil rights and human rights violations because they can get, quote unquote, the idea of healthy food. Because even in the corporate sector, there's no legal mandates for them to, reduce the herbicides, pesticides, things like that. And remember, the administration is deregulating corporations. The administration is more for corporate interests. So while it may sound, really crunchy granola on the outside, they're not the ones that are ultimately calling the shots. So if you're trying to help clean up the environment for the greater good of people and their health, then you may not want to deregulate corporations in order to do this. So you kind of see how it's real shisty. It's not clearly defined. And so I'll keep you guys apprised and I'll keep you guys posted. And so have an amazing evening. I'm going to jump off and drink the rest of my tea and figure out what it is that I'm going to be working on for you guys for Saturday. So, all right, bye now. Take care.